to our Policy Backstage of the UPUZ Conference. And after the amazing panel session on the healthcare system throughout the eyes of global leaders, we have a pleasure to have as a guest the General Manager of Novo Nordisk Hrvatska, Mrs. Mariko Shimizu. Welcome, Mariko.
Thank you so much, Anita, for having me.
And how are your reflections for the panel session? Did we manage to share the strong messages for embracing the innovations that really transform the healthcare systems?
I would say so, yes. I believe that all the leaders talked about common things. Linked to the innovation, we are really focusing on the prevention. We are also focusing on the Center of Excellence to address innovation. And then not only geographic challenge that we have, the Ministry of Health also talked about, we really think that it's very important. So we are talking about very common things. And then I would believe that this type of dialogue with Ministry of Health and then the leaders from the pharmaceutical industry would help to have the open dialogue and then really identify the win-win solutions.
During the panel session, we mentioned several times the importance of centers of excellence, yes, prevention, yes, the new guidelines that use the innovations on the horizon. So definitely a lot of work is, I would say, ahead of us. But on the other side, for instance, when we take some specific indications like obesity, for instance, this is something that really impacts the society in general. We need to find the new ways to address the impact of obesity for the communities, for the states, I would say. How your company can really address this issue, and you personally as a global leader in healthcare industry?
Thank you so much for the question. I think you are right that obesity is a health crisis globally. It's more than 1 billion patients has a problem. In Croatia, unfortunately, also has the highest obesity rate in EU. So this is something that we need to address. In fact, there is an interesting factor from US. So US is, of course, has the highest obesity rate in the world. But recently, they dropped the obesity rate by 3% in the last 3 years. This is the first time it happened. Why? Because there are innovations in the medicine which can prevent and then treat obesity. Our company is also focusing on the therapeutic treatment for obesity, and then we can definitely contribute to address the obesity disease, to prevent and then also treat in Croatia. And I believe that healthier Croatian will start from the less obese people, which is the risk factor for over 200 serious chronic disease like hypertension, cardiovascular disease, diabetes, infertility. Some of them are really fatal. So let's address the root cause first with the investment that we can make together with the industry, but also the government and also the healthcare professionals.
Recently, WHO also recommended the new treatments, innovations on the therapeutic horizon for treating the obesity. Yes. How can we contribute to the new dialogue, I would say strengthen the dialogue about obesity, that it really impacts not only patients' lives related to complications of NCDs, but yes, also it impacts on the economy, on the fiscal or financial aspects of the Croatia. It really tackles the society in general. We need to, I would say, mantra this day by day in this field.
Yes, absolutely. I think you are right that the WHO has really announced that obesity is a global crisis. Therefore, intervention is needed, and then there are medicines which can help to intervene. Now, I believe, of course, the health of the individual is very important by treating this disease. But if number of the obesity gets lower, healthier Croatians are more available it is more productivity. It's a longevity for life as well. Look at Japan. Japan is an aging society, but longevity of the health is much more because we focus on the preventive care for the chronic disease that can be treated and then addressed.
You mentioned Japan, and it's really an inspiring country, I would say, in many areas. But one of the concepts that Japan is actually highlighting quite often is the Kaizen, continuous improvement.
Yes.
How can we apply this concept in Croatian healthcare system? How can we motivate ourselves to be day by day better and to embrace the innovations that help us to live better, healthier life?
Yes. So I believe Kaizen actually has two components, right? So the one is a right situation analysis, because if you don't know where it's broken, you cannot address. So you have to always understand what is the biggest problem you have in the process or in a situation where you're in. The second is you have to also accept the fact that nobody is perfect. Nowhere is perfect. Japan is not perfect at all.
But imperfection is beautiful.
Imperfection is beautiful, and you have to accept it and then say, every day, I am not competing against someone next door. I am competing myself. So Japan tries to be better than yesterday's Japan. That's the concept, you know? So that mentality is the second component. I think right situation analysis and then also the right mentality would address or like it would strengthen the Kaizen philosophy, and then I'm sure Croatia can also adopt that.
That's really an amazing philosophy, but at the end of this short discussion, I have to ask you, what is actually behind the person of Mariko? We will again use the concept of kokoro,
Yes.
The connection between mind and heart. What inspires your heart and your mind that you become, I would say, a torchbearer in innovative industry?
Yes. So I used to work for actually food industry.
Really?
And then my company was providing the healthy product. So that is the way that I could contribute to the people's healthy lifestyle. I had, actually I have a daughter, and then I had a lot of her friends coming over to my house. And then I realized that many kids who have obesity are from the obese family. And I try to cook the fresh, green beans. She asked the question, what is that? She never saw it, the fresh green beans, because she only eats processed food or frozen food. And then I realized that there are many people who don't have an opportunity to learn healthy lifestyle, and then she will suffer with this, obesity complicated or obesity-related health issue. And then I really wanted to participate to touch people's life by providing the innovation. That was kind of like, my motivation to seek career change from food industry to pharmaceutical industry. And then I was very fortunate enough to work for the company which is leading the obesity innovation in the pharmaceutical industry.
You really, I would say, shine bright while speaking about your mission, and this is something that really comes from the heart, which is, I would say, the representation of authenticity. We spoke about the global leaders. Thank you for being one of them and to inspire us that we become better day by day.
Thank you so much, Anita, for this opportunity.
Thank you.